Hi everyone, I am here today with Dr. Toni Varela, and she is a naturopathic doctor. She's a really good friend and a colleague, and she focuses in regenerative medicine. So Toni, can you tell us a little bit about regenerative medicine?
Sure. So regenerative medicine just means using cells or substances that can actually repair and heal any sort of damage or stress tissues in the body.
Okay, great. So tell me, what kind of tissues do you usually work on?
So the ones that I use in terms of what kinds of stem cells are those that are umbilical. Sometimes they can be derived from the adipose tissues like fat cells or from the bone marrow, but a lot of that can be rather timely and costly to actually derive it. And to get the cells from a 2-term healthy baby, you actually get the most beneficial cells from that kind of youthful being. These are all voluntarily donated, and I use it mostly for regenerating joints. So for knees or for elbows, for shoulders, for example, the effects usually maximize for 1 year, and usually someone only needs one shot for that year or two. And then if they need further support, if it's arthritis or just overall degeneration, wear and tear, mild tears, sprains, strains, it's really effective. It's kind of like the espresso shot of all of regenerative injections in comparison to ozone or PRP, for example, so on and so forth.
So if somebody was tell me one of the main complaints that you're doing a stem cell injection for.
Mm-hmm. So usually it's for the everyday 40 to 60-year-old person who is regularly active, loves to run or bike ride, go hiking, and they've just had normal degeneration in their joints. Otherwise, even for arthritis, I've also done facial injections just to stimulate that collagen repair. And we also give it via IV for overall youthful regeneration.
Okay. So just maybe somebody who wants anti-aging or just wants to kind of keep tissues growing and rejuvenated.
So the great thing about stem cells is that they will go to where they're needed most. They will actually localize to a site if you do it via IV. They will follow the signals of those damaged tissues to regenerate healing in that area. So let's say you have a herniated disc, for example, where there's no cellular communication to bring cells naturally in that area over time. Stem cells will naturally go in there, whether we do localized injections or IV, and help to produce more proliferation and bring nutrients to the area to help rebuild that so that your spine is strong and you don't have to undergo surgery.
Cool. And so I know there's some other types of therapies that are also regenerative that you do. So you mentioned ozone. Can you tell us a little bit about that?
So ozone is actually the most supercharged oxygen that we have. So it's basically 3 oxygen molecules. It's electrocuted. What we use is a machine from Longevity Resources in Canada, and it just takes oxygen, medical grade, and electrocutes it to add another oxygen molecule to create this gas. What's interesting is that it's been used for centuries. We actually make it, and that's what's nice about all these therapies used. We make all of these things, like peptides and ozone. Our white blood cells make the ozone for fighting off infections and such. And one of the primary reasons why I started using ozone is because it is so great for colds, flus, even autoimmune disease, as it's an immune modulator. But also, if I can add it into an injection, I can proliferate the area that much more so I can do fewer injections at the site and actually increase the amount of healing response by getting the whole area with this gas.
So you're using it alongside the stem cell?
We can. That's what's nice, because they're all so natural, and because we are using them in these biological doses, it's very hard to have any side effects or overdosing.
Okay. And so what specific, so you mentioned boosting immune system, autoimmune disease, and then the joints and all of that. Is there anything else you use ozone for in particular that people should know about?
Even facial rejuvenation. What else? Lyme disease, for example, or if someone wants more energy, it actually brings more mitochondrial energy out of the cells. So from the cellular level, it's increasing our energy.
And do you do nasal insufflation and rectal insufflation, or do you only do? Oh, okay. Tell us a little bit about that.
So nasal insufflation or rectal insufflation is basically introducing ozone into those routes. So if you have a sinus congestion or sinus infection, or if you're looking to treat more IBD or Crohn's ulcerative colitis like issues, or even helping someone with cancer or abnormal tissue growth there, you can use that route by putting a tube, and transfer that ozone directly there to get the most healing effect of the ozone.
And I think some people are scared of ozone, like especially in those routes or through IV or whatever. Tell us about the safety of it.
Again, we make it, our white blood cells make it to help boost our immune system's response to foreign pathogens. I don't know how much more natural we can get than that. Maybe because it is a cost-effective treatment, that's why it's not really used in a more conventional setting, but it's also very diverse in its application, which makes it difficult for, let's say, a hospital setting to apply it to one thing, as they tend to compartmentalize things, and we're treating someone holistically.
Yeah, that's true. And then I know that you also use peptides. Can you tell me about those?
Mm-hmm. So peptides are basically chains of amino acids. They create those building blocks, for us for various, regenerative processes. So whether it's wound healing and repair, or reducing inflammation, or libido support, or if you want more growth hormone, more energy boost and vitality, that's what peptides are commonly used for. It's not a new thing. We have over 7,000 that we know of today. We also make peptides. Glutathione is the biggest antioxidant that we have, but it's also a peptide. It's not touted right now as a peptide therapy, as there's all of these new peptides that have been discovered and applied for these more regenerative programs like growth hormone support and libido support. But they do come in creams for overall collagen synthesis. They come in nasal sprays for libido support, to get your mojo back in the bedroom. And we can do injections, IVs. They all work together with all of these different programs. And they're also great to just self-inject at home, almost like an insulin needle, so that you can get daily support as needed. And what's nice, because they are just helping to build these processes in the body, like proteins, for example, it's very hard to overdose because your body's just going to utilize it as it's needed.
How do you mostly deliver the peptides? Is it through nasal, through injection, through, how do you mostly do it in your practice?
So usually injections, because it's the quickest route into the bloodstream, and they will go wherever it's needed again. So let's say you need joint repair or ligament repair, going closer to that side will have the most effective route. But if you don't like injections, you can take them orally. They have a lot of oral alternatives, so that if you need, gut repair, for example, or even want neurological repair, like if you know someone who has Alzheimer's or dementia, those have been really effective and helpful for overall programs. Also, at this time, with helping people's immune systems with the COVID virus, we are actually finding that thymosin, a thymus T-cell supporter, is actually helping people fend off that virus as well as others.
Very cool. So is that an oral delivery?
So that's the injectable. So usually for that one, we will do IV, but then we will find other oral replacements if someone doesn't tolerate an IV.
Okay.
Or is a bit fearful of injections.
How often do you have to do this stuff? So like, let's say for the immune system first, that thymosin. So how often do you have to do that to really boost your immune system?
Because everything is compounding in effect, really someone can come in once and that's it. It really depends on your age, your lifestyle. So obviously if you have a more well-rounded diet and exercise regimen, what your stress level is, the more grounded your lifestyle is, the more organic, non-GMO diet that you're eating, all of these things factor into how well you're naturally going to regenerate. So all of these things are just helpful. When we're looking at ozone, for example, if someone actually has an active infection like herpes, let's say, they might just do one shot and they're fine. Otherwise, they'll do back-to-back consecutive days, whether it's drinking ozonated water or doing the insufflation or getting the IV or even just a shot of it. They might come in a couple of days just to really help their body fight it off as best as they can, and then they're good to go. Some people actually come in monthly to just overall get support for their energy, for their immune system, so on. So it really just depends on the person and what kind of support they're wanting.
And can you do this stuff proactively, preventively, like if you're a woman or even you're a man and you just want to prevent your libido from dropping, or you want anti-aging and all of that, and then how often do you normally suggest that?
So if someone is doing, let's say, peptide therapy at home, it really just depends on the peptide. You could do it daily, you could even do it 3 times a day, or just as needed once a month. The cell cycle is 90 days, so a lot of our programs are for 90 days. And that could mean, again, one injection once a month, or if you want more support, it could be once every 2 weeks. It really just depends. And if you're just looking for that boost, that skin glow, glutathione you can do at home. Vitamin C actually boosts glutathione, for example, and a lot of people are using it in their creams. And I'm sure a lot of people have heard of collagen peptides. The reason why they'll do the peptide versus the protein is because it's more absorbable into the system and therefore more efficacious. That's why you'll actually find that it is more costly as well. So cost is actually a huge factor in all of these treatments. Ozone is going to be on the cheaper end. So let's say if you're coming to me for an IV, it's $210. If we're doing joint injections, the initial consult with treatment is $300. But if we're looking at things like peptides or PRPs, one injection is anywhere from $300 to $600 or more, depending on how much we need. And stem cells, for example, are always around 2,000 and can increase from there, depending on how much we need to treat.
And how quickly do people notice responses? So give me some of the main things you treat, and how many do we need to do, how long of a time, if it's a joint issue or even like anti-aging, how quickly and what will someone notice with the changes?
So usually you'll notice effects right away. For example, someone will come in for an ozone injection in the knee and they feel relief right then and there. And that might last 1 to 2 weeks. Again, depending on one's lifestyle, can they have some downtime? Not that it's necessary, but just to take some stress off of those joints will help them recover faster. Usually we say joint injections are anywhere from 3 to 6 treatments, 2 weeks apart, but they can be more widespread depending on one's rehabilitation. For PRP or peptides, again, it can be quickly noticed, a reduced amount of inflammation, and depending on the person, it can be just once a month where they themselves are doing the injections, or I'm actually sprinkling it into their joint shot. So again, that can be used with the ozone and done either every couple of weeks, or because we're having that added nutrient support, then it could be even 4 to 6 weeks. The same can be said for PRP, for example, where you only need maybe 3 injections over 4 to 6 week time, or even months. So depending on your own health and stem cells, for example, autoimmune diseases do not have as effective growth factors in their PRP as you find in stem cells. So for someone like that, they actually might want to use stem cells because you have millions of viable cells that are bringing nutrients as needed, and we're talking about 1 or 2 years that they can last.
And do you do PRP too?
Mm-hmm.
Okay, so can you explain what PRP is? Because I think you're saying PRP and people are like, what is PRP?
So if you've heard of the vampire facial, I think it became popular then, but platelet-rich plasma is basically taking blood from you and extracting your plasma by centrifuging the blood, and then thereafter giving you back that plasma that's rich in growth factors as well as nutrients to regenerate the cells. So a lot of people will do the microneedling to give that stimulation to the surface for cells to go in and repair, and then by using that plasma, either by injecting it to more desired spots like those frown lines and around the eyes. What's nice is PRP can be applied as well as stem cells in areas that maybe fillers won't go to, or Botox, because Botox can only be applied from the eyes up and fillers from here down, so you can do a whole holistic approach with them.
That's very cool. But you're saying that if someone's not healthy, if they have an autoimmune disease, etc., then their platelets might not be sufficient enough.
Not as nutrient dense as stem cells, for example. But at the same time, for example, ozone can promote growth factors as well to rehabilitate the skin and get skin rejuvenation. So all of these things have that purpose, but perhaps at different levels. I always say ozone is the green tea of regenerative action, and PRP and peptide therapy, for example, is the coffee, and stem cells are the espresso of the group.
And then, as you said, in terms of finances, it kind of increases as you go up the line.
Based on efficacy.
Okay, great. Well, this is awesome. I'm sure a lot of people want to know about this. And so tell us where you practice and where can we find you?
So I'm in Danville, California, in sunny California.
And where can they find you? What's your website?
Oh, Dr. Tony Varela. So that's drtonyvarela.com.
And I'll put that in the post when I do post this. Also, where can, if they're not local to you, where can they find a regenerative specialist? Is there a website or a place where you're listed where they can find a regenerative specialist, another doctor like yourself in their local area? Of course, you can fly out to Danville also, right?
Exactly.
I mean, Dr. V is amazing at this, and it's really the thing you specialize in, I would say.
Mm-hmm.
And people do come from all over the place to see you for this. So that's also a possibility too. But locally, if they're really far, where can they maybe find somebody?
Mm-hmm. So the American Academy of Integrative Cell Therapy actually has resources if you want to learn more about stem cells, whether for bone marrow and adipose use, or if you want to use umbilical, which is what I recommend because it's cheaper, there's no surgical risk involved, and you have millions of cells that are viable and have been screened for any sort of infections, and it's completely voluntary, so there's no harm done to the babies or the moms involved.
Cool. All right, great. Well, thank you so much, Dr. Wheat, and thanks everyone for joining us. And definitely follow and reach out to Dr. Varela.
Thanks.